Good afternoon. I'm very happy to be here with beautiful Jeju and present our research in front of you. I'm Hyundong, the third writer of this research, and I'm teaching counseling to future elementary school teachers at Won-Geon National University of Education. And let me introduce my co-researchers. The first writer is Won-Geon, very smart guy. He is a counselor in Korea Center on gambling problems. He transferred recently from Korea Rehabilitation Agency. This manuscript is a partial amendment of master's thesis by Won-Geon in 2018. The second writer is Eunsil. She is an assistant professor in Eunsil University and director of addiction rehabilitation counseling program in Eunsil University Graduate School. She is a pioneer in Korea in the addiction field because she built up the Department of Addiction Rehabilitation Counseling in Eunsil University in Graduate School program. It's the first and unique one, which has a basis on the psychological counseling in the addiction field. And now I would like to start to present about male rehabilitation protection recipients with alcohol problems. Many prisoners return to their communities after their release, but their recidivism is very high. The reason is that they have many stressors, such as family dismemberment, discord, social exclusion, stigma, and economic difficulties. As a result, they are more likely to experience psychological problems, such as low self-esteem, helplessness, depression, and anxiety, as well as increased violence and suicide. Alcohol use is one of accessible choices among ex-offenders to escape from the various difficulties and psychological distress. Several studies have shown that the prevalence of alcohol use is very high among ex-offenders. However, the drinking of ex-offenders is pointed out as a risk factor of recidivism. Besides, the risk of problem drinking can cause severe problems such as suicidal and suicidal attempts. Drinking is a risk factor and a trigger factor for predicting suicide. These results imply that male rehabilitation protection recipients with alcohol problems are also exposed to suicide risk. The difficulty of interpersonal relationship is being treated as an essential factor to increase suicide ideation. Also, depression has been reported to be a vital risk factor for suicide, including suicide and suicide behavior. Moreover, male rehabilitation protection recipients were significantly more depressed than the general population. On the other hand, interpersonal relationships have been reported to be an essential and robust predictor of depression and suicide. Interpersonal issues and adverse interpersonal events significantly increase the risk of depression and suicide. Although depression interpersonal problems, and suicide are common problems among the male rehabilitation protection recipients with alcohol problems. There are few studies on the structural relationship between depression, interpersonal relationship, and suicidal ideation. Therefore, the purpose of this study was to identify the role of depression in the relationship between the interpersonal relationship and suicide ideation among the male rehabilitation protection recipients with alcohol problems. The participants of this study were male rehabilitation with protection recipients with alcohol problems. They all were using welfare service in the Gyeonggi Province Office of Korea Rehabilitation Wage Agents. Among them, 184 males were sampled. They were 18 years or older and had drinking-related problems. And they agreed to the survey, and the data were collected according to a procedure approved by IRB of Namso University. The survey period was from October 23rd, 2018 to November 16th. Four instruments were used as a tool. The first one is the alcohol problem, alcohol use disorder identification test. And second one is interpersonal needs questionnaire device. It is this instrument consists of 30 items, self-report scale to measure frustrated feeling of belonging and feelings of burden. Third one is scale for suicide ideation. It is 1919 clinical research instruments designed to quantify and assess suicidal intention. Fourth, back depression inventory Korean version was used. Next, data analysis. To test the mediating effect of depression, we used the procedure of Baron and Canning using regression analysis. First, we examined the statistical significance of interpersonal relationship, its dependent variable, on suicide ideation. This is a dependent variable. Then we examine the statistical significance of the effects of interpersonal relationships on depression. Depression is mediating variable. In the next step, we examine the statistical significance of the effects of mediators on dependent variables. In the last step, we examine the statistical significance of the effect of independent variables on dependent variables after controlling the effects of mediating variables. At this time, we checked whether the influence of the independent variable appears less than the previous step. When the influence of independent variables on the dependent variables was significant, we call it as partial mediation. On the other hand, when it was not significant, we call it as full mediation. As a result, Table 1 shows the correlation and descriptive statistics among the main variables. Alcohol problems positively correlated with interpersonal relationships and depression, and moderate positively correlated with suicidal. Suicidal showed the moderate positive correlation with interpersonal relationships and a weak positive correlation with depression. There was a weak positive correlation between interpersonal relationships and depression. And as a result of following the steps of Brown and Kenny, depression partially mediated the effect of interpersonal relationships on suicide-ideation. The result of the SoCoRI test on the mediation effect were also significantly statistically significant. And figure 1 shows the model of this study research. Conclusion. The first conclusion is participants of this study have severe alcohol problems, suicidal and depression. Therefore, the Korea Rehabilitation agents should actively prevent and intervene in committing suicide among the male rehabilitation protection recipients with alcohol problems. Second, depression was found to play a partial mediating role in the relationship between interpersonal relationships and suicide-ideation. In other words, the more frustrated the interpersonal relationship desire, the more depressed, and they affect to increase suicide-ideation. Therefore, to prevent the suicide-ideation of the male rehabilitation protection recipients with alcohol problems, there is a need for intervention to deal with interpersonal relationships, depression, and suicide comprehensively and continuously. Also, it is necessary to specialize and expand the system, such as therapeutic custody, outpatient treatment order, and indictment suspension. That's all for my presentation. Thank you.